everyone, welcome back to this channel. Today, before I start with the discussions on MCQs, so let's start with one of the motivational quote which says, every accomplishment starts with the decision to try. So friends, today let us try and start preparing to achieve our goal in life. Question number 1. Vaginal canal normally has option A, an acidic environment, option B, an alkaline environment, option C, neutral environment, option D, environment difficult to determine. The correct option here is option A, which is an acidic in environment. Vagina has acidic environment due to presence of this bacteria which is called Lactobacillus acidophilus, and it is also called Doderlein bacillus or bacilli. The presence of this bacteria in vagina makes its environment acidic in nature by converting this glycogen into lactic acid. By converting glycogen into lactic acid. And this bacteria was found by one of the German gynecologists called, it is discovered by German gynecologist Albert Doderlein. And in healthy humans, this organism is found in the upper 2/3 of the vagina. Question number 2. The opening of the Bartholin's duct are situated in the option A, vagina, option B, uterus, option C, superficial perineal pouch, option D, vestibule. So first of all, we have to know what are Bartholin glands. Bartholin glands, there are 2 in numbers. They are sometimes called greater vestibular glands, and these glands are important organs in female reproductive systems. Their function is to produce mucoid secretion that acts as lubricant during female arousal, during female sexual arousal. And these glands are located in the vulvar vestibule at either side of, that means in both sides, the side of the external vagina orifice. So the question here is, the opening of Bartholin ducts are situated in the, correct option here is the vestibule. Correct option here is D, which is vestibule. And what is vestibule? It is a triangular space anteriorly bound by clitoris, posteriorly by foreshead, and laterally by the labia minora. And these vestibules, there are 4 openings into these vestibules. One is urethral opening. 2 is the vaginal orifice. 3 is the Bartholin's duct, opening of Bartholin's duct. and 4 is the opening of the skin duct. And what are these skin gland? Skin glands. Skin glands are homologous organs, homologous to the prostate in male. Question number 3. Peg cells are seen in the option A, intestine, option B, stomach, option C, fallopian tubes, option D, vagina. The correct option here is option C, which is fallopian tubes. These peg cells are found in fallopian tubes. They are non-ciliated epithelial cells that present in the lining of the fallopian tubes, and their function is to provide nutrition and protection to the ovum. Question number 4. Which of the following is the common site of fertilization? Option A, ampulla of fallopian tube. Option B, infundibulum. Option C, isthmus. Option D, interstitial. These are all the parts of fallopian tube, and it is also known as uterine tube or oviduct. These fallopian tubes are 2 in numbers, measuring around, the length is around 10 centimeter. And this fallopian tubes has 4 parts: the intramural or interstitial, the isthmus, the ampulla, and the infundibulum. And their function of fallopian tube is transportation of gametes, that is both male and female gametes, and is also a site of fertilization. And the fertilization occurs at the ampulla of the fallopian tubes, and it so helps in survival of zygote. The correct option here is option A, which is ampulla is the common site of fertilization in fallopian tube. Question number 5. Process involved in the development of mature ovum is called option A, fertilization, option B, oogenesis, option C, gametogenesis, option D, spermatogenesis. Fertilization, option A, fertilization, it is the process of fusion of male and female gamete to form a zygote. What is oogenesis? It is the process of formation of mature female gamete ovum. Gametogenesis, it is the process of production or development of gametes or development of gametes, and in case of male, it is sperm, and in case of female it is ovum or ova. And this gametogenesis includes both spermatogenesis or oogenesis and oogenesis. And in spermatogenesis, after the completion of spermatogenesis, we get the sperm cells which either include X chromosome or Y chromosome. And after the completion of oogenesis in females, we only get the ovum which contains X chromosome. And now spermatogenesis is the process of formation of mature male gamete sperm. So the correct option here is option B, which is oogenesis, the process of formation of mature female gametes ovum. Question number 6. The first evidence of pubertal development in females is usually manifest as option A, onset of menarche, option B, appearance of breast buds, option C, appearance of axillary and pubic hair, option D, onset of growth spurt. The correct option here is option B, which is appearance of breast buds, and the term for this it's known as thelarche. Thelarche, or also called breast budding. And the menarche is the first menstrual period in female. And the term for the first appearance of axillary and pubic hair is called puberty. And the correct sequence of development of puberty in female is first she will have this thelarche. Is the first evidence of development of puberty. That means she will have this, she will start breast budding. That means the first appearance of breast buds, and then she will have this puberty. After the breast buds comes, then she will develop this hairs in the axillary and pubic region, and then she will have her menarche, her first menstrual period. Question number 7. Painful menstruation is known as option A, amenorrhea, option B, dysmenorrhea, option C, menorrhagia, option D, metorrhagia. Correct option here is option B, which is dysmenorrhea. Dysmenorrhea means painful menstruation. Painful menstruation. Amenorrhea means the absence of menstruation. And this amenorrhea is divided into primary and secondary amenorrhea. Primary amenorrhea means when the girls did not have a menstruation till the age of 16 years. No menstruation till 16 years. Whereas in secondary amenorrhea, it's a woman who already had her menstruation before, but now she missed her menstruation for 6 months. For 6 months. It's called secondary amenorrhea. Or menorrhagia. And menorrhagia means regular time menstrual period with abnormally heavy or prolonged bleeding. Menorrhagia means the period is regular and is on time, but the female has a very heavy and prolonged bleeding. Metorrhagia means abnormal bleeding between regular menses or regular cycles. Regular menses. And this term came in NORCET 2022 and also came in AIIMS Mangkalagiri. This term came in exam NORCET 2022 and also came in exam AIIMS Mangkalagiri. Now there is a term called polymenorrhea. Polymenorrhea means the cycle length is reduced. It is a cyclic bleeding where the cycle length is reduced to less than 21 days and remain constant. Polymenorrhea means the female will have bleeding like every less than 21 days, and that will remain constant during her menstrual period. And there is also another term called hypomenorrhea. It is a scanty bleeding and lasts for less than 2 days. And another term is called oligomenorrhea. Oligomenorrhea means it is a cyclic bleeding where the cycle length is increased to more than 35 days. Cyclic oligomenorrhea, it is cyclic bleeding. That means during that bleeding, it means the menstruation is regular, but the length of the menstruation is increased to more than 35 days.